between you and your lunch, so I will try and be as quick as I possibly can. You heard a tremendous amount today already about the problems that we're facing in the healthcare system. So I won't dwell on this, but we all know that we inherited a really, really challenging legacy from our post-Soviet system. We have too much infrastructure. We've got more hospitals per person than we do than some other countries, some European countries, and yet 53% of our diagnoses in primary care are wrong, which is more than half. We focus on overtreatment instead of prevention. Our system is expensive. We spend almost the same amount that we bring in from our tech industry, as in the IT industry, in GDP, 7%, on just non-communicable diseases. Those are crazy figures. Most importantly, we lack capacity at the right level and in the right places. So in rural communities, we have very little quality capacity. And look, you've heard lots. We need to change the systems, we need to change the way that we work, we need a culture shift. But how do we create that without the right people? Well, we think that we need to build the next generation of healthcare leaders. People who deeply understand their communities, who care about their communities, and who are able to create that systemic change. Critical thinkers, systems thinkers, people who understand design thinking, people who are ready to create this change. And we focus on the primary care system because we want to see prevention, we want to see a healthy population, rather than think about how we treat patients. So our approach is to train the leaders who can fix the system. We bring expertise from the diaspora and from local professionals, and we put that into our 2-year healthcare leadership program. This is a really intensive program with weekly training sessions, with quarterly retreats in person, and is delivered in partnership with Henna Foundation and with the Ministry of Health. And we believe that this will help us build a national talent pipeline of healthcare leaders. This is the program. So we have 4 pillars: leadership, community engagement, quality and research, and medical knowledge and skills. A medical knowledge and skills component is delivered by our strategic partner, Henna Foundation. And as you heard earlier from Lorki, there's a focus on competency-based training, and we apply the same approach here. Of course, it's not a residency, so it's not the same level, but we do apply the same approach, and we apply it across the whole program. So that means that in order for them to know how to use their leadership skills, community engagement skills, and quality improvement skills, they carry out a quality improvement project in their first year, a real measured project with baselines and final results, and a community health project in the second year to truly understand how to create change in their local communities. We currently have 21 doctor leaders on our program. They're serving over 45,000 patients, and we work across 7 regions, but we welcome applications from all doctors and from all family medicine physicians right now. This is one of our doctor leaders, Lusine Manukyan. She is a fantastic physician, pediatrician by training, who then retrained as a family medicine doctor. And the impact that she has had on her local community has been so visible from day one. When she moved to her local community, she's a part-time physician, and she was working part-time in a private clinic. And when the private clinic made her an offer to come in full-time, her patients went to her director, begging the director to keep her in the clinic. In just a short amount of time of a year, she built such trust in a community that did not have trust for their doctor, who did not come in for routine examinations for hypertension or for diabetes, and she created real change for a quality improvement project. And currently she's working on another project to bring the community together on a health-related issue. So just a little bit about challenges. We find some challenges around bringing in the right professionals with the right skills to teach our doctor leaders, both locally but also internationally. There's a language barrier. There is a finding those people. I heard so many interesting speakers today. I'm definitely going to be drawing on some of your expertise. We have a very small pool of qualified family medicine doctors, and I'm not saying that we don't have family medicine doctors. I'm talking about people with the right leadership attitude and skills to actually be part of this program. And we face challenges with deploying these people into the regions, because lots of people who are doctors who've done their residency are already a little bit older, they've got families, and many find it a little bit more difficult to move to the regional communities. Our model is based on the Teach for Armenia model. If you've heard about Teach for Armenia, you know the incredible work that they're doing, and they place teachers in the regions. They're often young people straight out of university, much easier to place. For us, family physicians, this is much, much harder. In terms of next steps and how others can get involved, we're recruiting 20 new family medicine doctors this year in 2026. So if you know promising people with real leadership potential, please send them our way. We'll be launching an Alumni Primary Care Champions program this year to support leadership pathways for doctor leaders. We want to see our doctor leaders making change in the system. They will be the future directors of clinics, heads of health departments in their marsbedarans, and why not deputy ministers of health, if not ministers of health. This is where we see their pathways, and Teach for Armenia has proven that it can be done in education, and we will be doing the same in healthcare. And we will be also expanding to nurses and pediatricians in 2027, so watch this space. Our vision is to see an Armenia where everyone has access to a high-quality, patient-centered healthcare system. And we are doing that by building resilient leaders and systems to transform healthcare in Armenia. For the type of problems that are coming our way, we talked about AI, we've talked about a really rapidly changing world. We need resilient systems, and we need resilient leaders who can push us forward with that change. Thank you very much.